Hey, I'm Dr. Brian McKay and presenting some flexibility exercises anyone should be able to do. They're a little more difficult than our last video. Hopefully you're learning a lot. Let's get right down to it. I represent Core Health in Darien, and we want to make seniors even healthier. Healthy seniors can always get healthier. And so you start an exercise program. Let's start realistically, and you want to do is 2 to 3 times a week and about a half hour each time. And you can work yourself up to 4, 5 times a week, even 6 times a week. These exercises are not going to hurt you. They will benefit you. If they hurt, you stop, regroup, watch the video again. Very easy to do, and hopefully very beneficial as well. Now we're going to get started with the first one, and I call that the hip. Let's get the hip stretched out. See how many fractured hips there are out there? And basically, you're on your back, and you're going to bring both your knees up together, as you can see in the top image right here. And you're slowly going to lower one knee to the side. You know, you do for a 7 or 8 second count. Then you bring it back up. Do the other one for another 7 or 8 second count. And you repeat this, you know, it says 3 to 5. Let's do even more. Now, let's do the low back. You're going to bring, very similar. Bring both knees up, arms into a T shape. And you're going to slowly bring the legs to one side. You're going to keep it down there for, 20 seconds. The other side, bring it back up to the middle. Then down the other side for another 20 seconds. And you're going to do this 4 to 5 times. Opens up the pelvis in addition with the last one and the low back. You get a good core stretch here. Very important. Also very, very effective. Now the next one we're going to be looking at is a shoulder. And this is really simple. And you're already on your back, so let's just do it now. Where it looks like yes or no, like when the referees do their football. Either it's a yes and the ball goes through the field goal, or not. Well, very simple, but it's a good shoulder stretch, and it works your clavicle and your scapula in conjunction with each other. And you're doing this already since you're on the floor. Much more effective. And you're going to hold it, again, 20 to 30 seconds. Repeat it 3 to 5 times each side. Very, very helpful. This is one, you can do this on the floor. You don't necessarily have to do this sitting down. You kind of bring in this case here, you bring the left foot out to the side, and you get to that position where, you tuck that left foot around, and you just try to go forward slowly, keeping your back straight. And you want to do it again, 20, 30 seconds, 3 to 5 times each side, and you will feel more flexible. You're going to get flexible. Don't expect it to happen overnight, and expect a little bit of soreness. It's probably a better approach this with a little bit of realistic, knowing that you're going to be sore afterwards. But good thing is, you're exercising, and expect to be sore. It's always a good thing. Here, we're going to lift the back of the leg up, so you're going to lay it flat on your back, and let's start, keep one leg bent. In this case, you're going to raise the right leg up, and you're going to try to grab it in the calf. If you can't grab it at the calf, grab it at the base of the knee. What you're going to do, hold it for 20, 30 seconds, 3 to 5 times each side, and do the other side. Very, very good. You'll be thanking yourself because you'll really be stretching out the hamstrings and keeping your lower extremity nice and flexible, and you'll prevent a lot of injuries. This is really simple. You're just going to lock your hands behind your back, and you're going to turn your head all the way to one side, and you're going to hold that, for about 30 seconds. You're going to do it the other side for about 30 seconds. You're going to repeat it about 4 to 5 times on each side. Pretty simple, self-explanatory, but are you doing it? If you're not doing these exercises, now's the time for you to get out there and start. Well, we're not done yet. This is a little more complicated, and this is really good for shoulders because a lot of people lose shoulder mobility. All you do is just take a towel, a dish towel, hold it with one hand, in this case the right hand, and you're going to wrap your other left hand behind, and you're going to pull. And you're going to pull with the lower hand, and you're going to pull the upper hand. You're going to get a really good stretch throughout the whole shoulder, scapula, the clavicle, and the humerus, and get that whole area. Even the lower part of your neck will get stretched out here. Very, very effective. I hope you've liked these exercises. I hope you've benefited from them. I'm Dr. Brian McKay from Core Health. If you have any questions on these, if you want more exercises, come speak with our physical therapist, very qualified, and get the exercise you need. You will stay flexible. You will stay out of the hospital. And more than important, you're going to stay out of a nursing home if we can help it. The number there is 656-3636, 656-3636. Call us up, set up an appointment. We do accept Medicare, so that's one more thing for you to know. But we are here to help. And if you have any questions on these exercises, feel free, get in touch.